Turning now to COVID-19, children 12 and older will be eligible for the Pfizer vaccine soon. Health officials anticipate the emergency use authorization to receive CDC approval by late next week. But even vaccinated parents have concerns about getting their child vaccinated. Nikki Schenfeld has the story.
Getting your child vaccinated could make the traveling process easier. Plus, some parents might feel more comfortable sending their kids back to school in the fall. Lieutenant Governor Josh Green says it's a personal decision and parents should take the time now to talk about it with their kids and with their physicians. The U.S. Food and Drug Administration is expected to authorize emergency use of Pfizer's COVID vaccine for ages 12 and up, giving Hawaii an additional boost towards herd immunity.
If the goal is to absolutely stop deaths, then you want to get the vaccine to individuals 50 and older. If the goal is to stop community spread, you want to get down to age 18 or 12, depending.
According to phase 3 of Pfizer's adolescence trial, 2,200 participants demonstrated 100% efficacy and strong antibody responses too, even higher than the trials with participants 16 to 25 years old.
The mRNA vaccines, what they do is they send a signal that there's this chemical out there that needs to be defended against. You create antibodies against it, and then those antibodies can attack what's called the spike protein. That spike protein is specific to these coronaviruses.
If you get exposed to COVID, the antibodies attack it.
Doesn't cause infertility, it does not cause mutations, does not cause other abnormalities of any kind. We've been doing vaccinations for a long time. We've been using mRNA for a long time.
Green says parents should talk to their kids first and consider the risks that could bring the virus into someone's home, like hanging out with friends and summer jobs.
Deeply personal choice. I will not fault anybody if they choose to not vaccinate their children. We're having that conversation here at home. Here on Mother's Day, Jamie and I are talking about whether or not Maya, who's 14, should be vaccinated, and we're having that conversation with her. We think you should respect children. We also think it's a good time to talk to your pediatrician and find out what their recommendation is.
He adds hundreds of millions of people have been vaccinated with little risk and exceptionally low side effects.
It's been about 1 in a million for the bad stuff, which is typical of any vaccination, about 1 in a million. So we're getting through a global pandemic which shut the world down. It actually shut the world down, and we can't do that again if we can help it at all.
Just like adults, if you have any questions about the vaccine, consult your doctor or pediatrician.